right. So what I want to do is I want to go through the quiz one, chapters 1, 3, 4, 5, 6, 7, and 8, talk a little bit about it and kind of how to approach each question. All right, so all of these are on the same page. And what we're looking at here is when we look at QT prolongation, there's one thing that we're going to attach that to, and that's going to be dysrhythmias. When you see QT interval, you can think of the QRS complex, all of those things. But when you think of QT, think of heart. When you think of heart, you think of dysrhythmias. The acronym ASA, or acetylsalicylic acid, is a chemical name. So it's the chemical name of the medication. And what I would have done here to prepare for this question is to go, okay, well, what's the brand name? I'll write it down. That's like Ecotrin. And what's the generic name? That's aspirin. Okay. And then what's the chemical name? Acetylsalicylic acid. And when you write those three down, what you can see is, okay, well, in Ecotrin, I don't even have an A, an S, and an A. In aspirin, I have an A and an S, but I don't have a second A. And then in acetylsalicylic acid, I have an A, an S, and an A. So it took actually writing it down probably for most people to get this one right. But again, you want to be judicious with your time, but you don't want to go so fast that you get them wrong. A drug is safe but not effective. Then we would still use it for HIV or cancer or whatever it is. False. If it doesn't do anything, then that's not going to be something that we're going to use. And while some drugs are effective and not that safe, we're weighing risk-benefit. But in this case, we would say, okay, that's false, because if a drug is safe and not effective, then we're not going to use it. Which one allowed for quicker or new drugs for HIV or oncology? HIV came around in the 80s, so the only one that would be even a possible choice would be the 1992 Prescription Drug User Fee Act. And really what we were seeing was, the average time to get a drug to approval is 17 years, and that's quite a long time. From the point you discover it to the point it makes it to market. So when someone puts $1 billion and 17 years into something, that's quite a long time. But if that time is longer than the time the patients are going through the cycle of some kind of tragedy like HIV, then we have to make some decisions about, can we use that early? Breast milk and exhalation correspond to modes of absorption in pharmacokinetics. Breast milk and exhalation are forms of excretion, so it would not be absorption. So this one is false. Of the drug characteristics, we expect blank to be the most important, because if it's not there, there's no reason to take the drug. And a lot of times in a quiz or a test, the answer to another question is in a prior question. In this case, it would be effectiveness. So again, safety, it's important, but if it's not there, we still use drugs that aren't safe. If taste bad, well, many drugs taste bad. And then selectivity, just think of caffeine. It would be ideal if caffeine didn't make your heart race, but we take it anyway. I see the lines out the door at something like a Starbucks or someplace like that. And you think, okay, well, I'm going to cross this one off, cross this one off, cross this one off. And this also brings another good point, which is there's really two ways to answer each question. Either you find the answer that is correct, or you eliminate the ones that are not. When I was taking the graduate record exam, the GRE, I scored a 98th percentile in English and 87th percentile in math. And to give you an idea of how hard it is to score that high, 1 million people took it, and 1,000 people scored that high in both of them. So it's very usual for someone to maybe go into an English major and score very high in English, but not high in math, or to go into engineering and score high in math, but not so high in English. But if you combine those two, I scored in top 1,000 of those million people that took it. And what allowed me to score so high was that I didn't always know the answer, but a lot of times I knew what wasn't the answer. And in health professions, this is known as ruling things out, or uh, kind of maybe differential diagnosis in another way, where you're just kind of saying, well, it's obviously not going to be taste, because that's just, if it doesn't taste good, but it still works, we're going to use it. If it's not safe, well, what's an example where something is not safe? And this comes to some extent to experience, but we talked about it. And so cancer would be an example, HIV would be an example. And then selectivity. Well, gosh, sometimes the drug works on just what we want it to, but sometimes it works on other things and causes side effects. Maybe diphenhydramine would be your example, where, well, it takes care of the allergies, but it makes you drowsy. So it's not as selective as we would like, but it still works. But we have to have effectiveness. There's no reason to take it if it's not. First pass effect is primarily regarding the effect of the lungs on drug metabolism. And anytime you're taking one of my tests, it's going to be looking at, is everything correct? Okay, so first pass effect on blank on blank. Okay, so first pass effect is with metabolism, but it's not the lungs, it's the liver. So this one would be false. A patient taking milk of magnesia and ciprofloxacin create a concern about. Okay, so you would have to know what each of these is. And you say, okay, well, chelation, what is that? Well, chelation is when you have multivalent, and multivalent means +2 or +3 charge. And you see, okay, well, magnesium is a +2 charge on the periodic table. And ciprofloxacin is an antibiotic, and this was in there, the notes. CYP3A4 induction or CYP3A4 inhibition. CYP3A4 you could have substituted with just liver induction or liver inhibition. And that's just saying, okay, well, is it going to make the drug go up, go down, and then metabolism itself? But it was all chelation. Unfortunately, milk of magnesia will bind to the cipro and make it ineffective, and that's something we certainly don't want. Patients with liver and kidney disease might need their dosages increased. So what we want to do is say, okay, well, what's going to happen? And a lot of people say, okay, well, if they've got disease, then that means that they're not working as good, so we're probably going to need more medicine. Well, what that was the exact opposite of what we want to think, which is, wait a minute. If they're not working, they're not breaking down drug. If they're not breaking down drug, then there's more drug around. So they're going to actually need their dosages to be lowered. Okay, so that would be false. You might expect that a placebo drug contains active ingredients. And the definition of a placebo is that it does not have any active ingredients. It's a sugar pill. Some people respond to just having some medicine, and that's why when we're doing a trial on a drug, we want to make sure, okay, we're going to give one person the sugar pill and one person the real drug, but we're not going to tell them which is which, because some people will still have a good effect, even though it wasn't the drug, because they thought it was the drug. And so when a drug trial comes around, that drug has to be not above the regular effect, but above the placebo effect. So you might expect that a placebo drug contains inactive ingredients, so this would be false. Okay, I didn't like the way I explained this one before, so I re-recorded this one, but I wanted to go over the 4 possibilities of beneficial potentiative, detrimental inhibitory, beneficial inhibitory, and detrimental potentiative. And when you have these kind of, I don't know what you want to use, is maybe words that are a little bit, they kind of obfuscate, they make it a little bit harder to understand what's going on. We kind of go back to the sheet that I gave for the review sheet, and you'd say, okay, well, what was beneficial potentiative? Okay, that was when we had clavulanic acid added to amoxicillin, an augmentin, to increase the effects of amoxicillin. All right, so what was happening was we had 2 things working together, potentiative, and that created a benefit. What was detrimental inhibitory? Well, detrimental inhibitory was when we had that asthma medicine, albuterol, and the propranolol, which blocked the beta receptors in the lungs that albuterol works on. So it was detrimental because it was a bad outcome, and there was an inhibition. We were blocking those receptors. Beneficial inhibitory was when we had naloxone, and it was blocking the respiratory depression from opioid overdose. So it's an inhibition of that opioid overdose. But it's a good thing that we're blocking it and trying to save the patient from the respiratory depression. And then the last one was detrimental potentiative. When we had the patient with warfarin and aspirin, and both are working together, they're potentiative, that is, the aspirin and warfarin work together to cause bleeding, and that's detrimental because it's bad. So if we're talking about the lungs and the heart rate, that would go with the albuterol and propranolol, which was detrimental inhibitory. Parents gives diphenhydramine to a child to help them sleep on a flight. However, the child shows signs of excitation rather than somnolence. What does this affect? And maybe you don't know what that word somnolence means. Okay, you've got the whole of the internet. Let's look it up. Somnolence. Oh, it just means sleep. Okay, so they got excited rather than sleepy. Okay. The parent gave it, so it's not the doctor's fault, which is iatrogenic, or the prescriber's fault. Paradoxical. Well, what did I expect? I expected somnolence and I got excitation. So paradoxical is actually the opposite of what I expected, which is what this is. But let's see if there's another one that might also be right. If you're in a hurry, you would end there. Say, I found the right answer, I'm done. But if you're not in a hurry, I see I have 14 minutes left. I'm not going to hurry. I'm going to work through these last ones. Carcinogenic. Well, carcino means crab, and genic means create, so create crab. And this comes from cancer and how tumors looked a little bit like crabs to people before we had names like cancer and oncology and things like that. So that's cancer causing. And then allergic. Well, they're trying to the allergy is the pathophysiology. That's not the excitation that's coming from it. So an allergic reaction would be like rash or something like that. So the best answer, and that is a dreaded word, but the best answer is definitely paradoxical here. When a prodrug goes to an active form, this is a function of absorption, distribution, metabolism, or excretion. So a prodrug, maybe we have to look it up, 13 minutes. Prodrug is before a drug, and what it's really saying is what makes something go from before the drug to the drug. Is it absorption? Well, if you absorb a prodrug, you still have a prodrug. If you distribute a prodrug, you've still distributed a prodrug. You still haven't converted it into its next form. If you've metabolized it, and we take this meta means to change. So when we've changed the prodrug, then we've changed to a drug. And then excretion, well, you aren't going to get rid of it to make it into its active form. So that wouldn't make sense either. So metabolism would be correct here. Did I put all the buttons? Yeah, I just want to make sure. Okay. If neither researchers nor subjects who received an experimental treatment, this is known as, so subject and researchers. So that's going to be two. So if it was just researchers or subjects, it would have been single. Since we have both, it would be double blinding. And then a drug that speeds up the rate of metabolism of another drug, we know this to be, okay. So absorption is a partner to metabolism with distribution, excretion, so that's not really it. Induction, that affects metabolism, and inhibition affects metabolism. So it's one of these two probably. Okay. And then I look at chelation. Chelation was that one where we have the binding of the dairy, calcium +2, or magnesium +2, or aluminum +3. So that's not quite it either. So what is going to speed up the rate of metabolism? Well, I think it's easier to go from backwards from inhibition, but inhibition will actually slow the rate of metabolism. Okay, so you've got a drug and you've slowed it down. And so that's not going to be the right answer. A drug that speeds up the rate induces it. Okay, so maybe a good way to kind of visualize this is talking about the relationship between siblings. Is a sibling going to inhibit a fight or stop a fight from happening? Or are they going to induce a fight? Are they going to start a fight from happening? and or start a fight happening. And this is usually what happens. So my kids, they're great. They normally get along, but sometimes somebody just says the wrong thing at the wrong time, and voila. Okay. Submit the quiz. Yes, I'm sure I want to continue. Okay.